Woman who told a very interesting story, which is not like the usual story you hear on this program. So she was sent by her doctor to a big neurosurgeon at a big hospital. He told her that she had to have gamma knife treatment. There were no other options. She couldn't have surgery. We're just going to take this call. Excuse me 1 minute. Hello, good evening. It's Dr. Lederman. You're on the radio. You're speaking. We're on the radio. Do you have a question for 50,000 people to listen to?
Yes, I do.
Okay, go ahead.
Okay. I'd like to know what Dr. Lederman's take is on a person that has a lung disease, a bronchiectasis, and 3 non-calcified lung nodules.
Okay, well, I suggest this is Dr. Lederman, so you're not going to get a take on him. This is he. What's really best for you is to come into our office, let us look at the scans, let us review all the documents in person. Curbside consults aren't going to help you a heck of a lot. So please just give us a call at 212-CHOICES during the week and make a date, and we can go through all the documents and give you a real opinion about what really to do. Okay?
Okay. Thank you. Do you usually watch those nodules?
We usually try to give you the best advice. And the best advice is to come in, spend some time, and don't rely on a 30-second opinion. It won't help you. Spend an hour or two. Your life is worth it. Come in, spend an hour or two, and we'll go through all the documents. We'll review your films and help you decide what is best for you.
Great. I'll make that appointment. Thank you.
Thank you. God bless you. Bye now. So, as I was saying, 55-year-old woman, pain in the face. She was found to have a tumor. She was sent to a big doctor at a big hospital, neurosurgeon, who told her she needed to have gamma knife treatment, and he gave it to her. She had one treatment at a big hospital, and that was a year and a half ago. And then she came to me. Well, why the heck would she come to me? Well, either the treatment is no good or she's not happy, right? Well, that's right. So she's not happy. She's not getting answers. She's not understanding what happened to her meningioma that was treated with gamma knife. I met her on Friday. She's a very interesting, nice woman. She had this terrible pain because the tumor was by the trigeminal nerve, which is the nerve that controls the sensation to the face. So she had terrible pain in the face. She now comes back to me telling me this story and wishing to know what to do. Why didn't she go back to her surgeon? Well, interestingly enough, I asked her that. She said the surgeon and the hospital were paid $30,000 for her treatment. She owes them $70,000 more, and the doctor won't return her call until she pays the $70,000. Wow. So here she has a brain tumor. She had treatment. They've already paid $30,000, and no one will return her calls. So she called us at Radiosurgery New York to sort through her case. So she told more about the doctor there. It's a big shot doctor. He walked in the room with a clock, and he turned on the clock when he walked in, and he turned off the clock when he walked out. And she said he seemed more interested in the clock than in her. She said he was only with her twice for a couple of minutes each time. We've called for all the reports. We've called for the images. We're going to get to the bottom of this. Our data for meningiomas with fractionated stereotactic radiosurgery, which is non-invasive treatment, no pins in the head. She said, by the way, gamma knife with the pins were very painful. I don't know which was more painful, the gamma knife treatment or not being able to speak to her doctor. She was pretty disgusted with both. He never offered her non-invasive fractionated radiosurgery, which has no pins in the head. We abandoned a gamma knife style treatment in 1993 to give you an idea of how long we've been performing brain radiosurgery. Our success rate, as I said, is very high, 97%. She has my cell phone, and she can call me day or night. And we're going to get to the bottom of this. And meanwhile, by the way, you should know that hospitals cost much more than private medical centers. Actually, a report out said that they cost about 200% more. In this case, it's about 1,000% more. So they got paid a lot of money they're not responding to their patient, you would think that there's some commitment between the doctor and the patient that he return her calls. And as a bookend, so as a tale of two cities, let's say, well, this is a tale of two patients. A patient came in this week, 60-year-old scientist from the tip of Long Island. I treated him in 2002 with an acoustic neuroma. He had fractionated stereotactic radiosurgery. In 2002, he's a tip of Long Island. He works as a teacher and a scientist. He had vertigo and decreased hearing when he first came to me. He's been stable ever since. He calls me whenever he wants. We don't charge him. We don't look at his medical record. We don't look at his billing record. Whenever he wants, he calls me. He has my cell phone. He has my email. He has answers. So we're arranging for him to get a new MRI to make sure his acoustic neuroma is successfully treated. We actually have published a paper showing that we've had no recurrences of acoustic neuromas after 5 years, and there's actually very few before. The success rate with stopping the tumor, shrinking it, or making it nearly go away is about 97%, up there with meningiomas. So acoustic neuroma treatments, we have the largest experience in the world with fractionated radiosurgery. My life is filled with patients who have acoustic neuromas, and management of the case after treatment is as important as treating the patient. So there's actually very few specialists who deal with this disease. There's only about 2,000 acoustic neuromas in America, and this gentleman is out 12 years, doing well, with intact hearing, which is very different than if he had surgery. If he had surgery, he would have been deaf, and there's about a 50% chance he would have had facial paralysis after surgery. Again, if you have questions, please call us. We're at 1-800-321-0710, 1-800-321-0710. It's Dr. Lederman, the Radiosurgery Hour. We're taking your calls. If you have any, don't be bashful. I certainly get plenty of calls all week, day and night, so this is a great time for those who are bashful to call. We had a woman fly in from Russia for treatment, beautiful woman with anal cancer metastatic to the liver. She was treated actually last year and has been successfully treated in the liver. She was seen elsewhere, and they wanted to retreat her, but in fact, when we looked at her scans, the cancer in the liver was stable. She had several different metastases, one in the chest, one in the lung, and we offered her various forms of therapy. Back home, she was given extensive chemotherapy, which didn't work as she wished. She's had great luck with radiosurgery, and so she's going to be treated for metastatic anal cancer to the liver and lung and lymph node. Chance of success where we aim the beam is very high. Treatment is very well tolerated. She wants to move to New York. She loves it here. She's only wishing for good health and good results, and we wish her the same. From the news department, an article entitled, and this is published in the Wall Street Journal this week, Medicare's Puzzling Refusal to Cover Lung Cancer Screening, written by Douglas Wood and Ella Kazaruni, two lung surgeons. And they start out their article saying, if you could save thousands of lives, would you do it? That's the question that Medicare officials are now considering, whether to approve lung cancer screening for Medicare beneficiaries. It's estimated that 14,000 lives could be saved each year in the Medicare population alone if there was screening. Why is it? Well, lung cancers often grow. You can't feel your lungs. You can't feel a nodule in the lung, unlike the breast or elsewhere. There's no other early screening like there is for breast cancer or cervix cancer or colon cancer. There's been studies done, actually one of the largest studies done in the United States was done between 2002 and 2010 that evaluated thousands of patients, 53,000 patients, and showed there can be a 20% reduction in mortality from lung cancer if only people are screened. That is low-dose CT scans in patients who are at risk, usually ex-smokers in older populations, finding cancers before they have the potential to grow, travel, and be fatal. So the data is in. we can either take this 20% reduction in mortality from lung cancer by screening, and we screen for breast cancer, we screen for cervix cancer, we screen for colon cancer. So why isn't Medicare screening for lung cancer? It's a little bit incongruous. They closed the article saying, if you were making policy about a procedure that could save the lives of some 20,000 Americans of all ages every year, what would you do? To most cancer physicians, the decision seems easy. Lung cancer screening can provide the next significant victory in the long war on cancer if it gets approved for everyone who needs it. So think about that. Another political decision by the government. They want to give us Obamacare, but why don't they give us medical care that allows for lung cancer screening? It only makes sense, does it not? Happy to hear your voice about that. And while we're talking about lung cancer, we had a patient come from upstate this week, a woman 61 years old, married with 3 children, who had lung cancer. She came in, said she had stage 4 lung cancer. She lost a lot of weight. She had multiple chemotherapies. She had 3 different chemotherapies, which she said didn't work. She stopped them about 3 years ago. She's lost weight. She's very slender. She weighs about 87 pounds. She has some pain in the chest. Examined her. As I said, we stage up the patient. We try to get the best possible staging to see where the cancer is. We do cancer markers. We staged her up. We got everything done in one day. She was from upstate, and being in New York City was really a foreign territory for this woman. We got everything done in one day. She went back home to upstate. She called the next day. I gave her all the results. Cancer markers, negative. PET CT, negative. No cancer detected. Wow. Was she happy? She thought she had a death sentence with stage 4 cancer. We staged her up. No cancer. So is this good news, department? I think it's good news for her. She doesn't need any treatment now. We'll have her come back in about 3 months. We'll check her out. Right now she's doing well. She had a history of aortic dissection where the main blood vessel from the heart breaks and dissects. That was repaired. She has a history of smoking with some emphysema. Those issues have been addressed. Now we'll see her back in 3 months. No treatment for now. She's doing well. No treatment for now. Wonderful news for this woman. We're going to break. This is Dr. Lederman from the Radiosurgery Hour. We're going to hear from a few new voices. We're happy to take your calls. If you have questions, call us. Noah and Ed are at the studio running this place. Great studio, great staff, and great program, isn't it?
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, Super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman 212 Choices. Cherish your life.